disease in New Jersey says, quote, "I believe the biggest misnomer is that opening early will kill more people. That's as far from the truth as possible." Joining us now is Dr. Livornese and Dr. Scott Roethle, an anesthesiologist who you might remember was on a few weeks back from Missouri, who recently spent 23 days working at a hospital in New York. Welcome, gentlemen.
Thank you.
Hey, thanks for having us.
Dr. Roethle, as we mentioned, you were in New York. You traveled out there to help. Let me ask you, what did you learn from being in New York City? What did you see? And specifically, what I'm getting at is, I remember when this whole thing broke out, we talked about how this was basically the flu on steroids. People had a fever and other symptoms that were associated with the flu. Now we're hearing about things that may not necessarily have been early on associated with that. For example, blood clotting and other symptoms that are popping up. What did you learn in New York?
Wow. Well, do you have an hour? I learned a lot. It was an amazing disease. I saw a lot of very sick people. The healthcare system, when I got there, was on the brink of being overwhelmed, and just hundreds and hundreds of deaths. The disease is very different from the flu. I would say for a vast majority of the population, it would be a severe flu-like illness, but it causes so many other pathological abnormalities in the kidneys, the heart, the brain, blood clots, like you mentioned. It's a much more complicated disease than just the flu or the flu on steroids. And people were extremely sick. I was just very surprised when I got there and what I saw, the dozens and dozens of patients that I saw and the deaths that I saw. It was amazing.
Dr. Livornese, have you seen a big change in the diagnosis from where we were, say, a month and a half ago to where we are now in terms of the symptoms that people are exhibiting?
Oh, definitely. Just I guess last week, the CDC started to add other things to what they consider part of the diagnosis, such as loss of smell, loss of taste, diarrhea, which we all kind of saw from the beginning, but then now that we really see that as much more. And first, I'd also like to say, Scott, thank you. I live in the New York metropolitan area, and this was my job. For you to come out here and to go right into the dragon's mouth, that's a big move. Thank you.
My pleasure.
Dr. Livornese, a lot of people are starting to be concerned about reopening. We're seeing different states reopening, saying if we open too soon, that more people are going to die. You're saying that that is a big misnomer, that will not happen. What did you mean?
Well, we all talk about flattening the curve. We're flattening the curve so the healthcare system is not overwhelmed. We're not changing the area under the curve, which means that the area under the curve is the number of people who are going to be infected. We can't change that. We have to keep going, and they believe about 60% of the population has to get infected for us to get herd immunity to get control over this disease. So it's going to happen. We need to just slow it down so our healthcare system isn't overwhelmed and we can care for the people as well as we've been doing.
You've also said that regardless of what we do, we might have the exact same effect. Do you think that some of these shutdowns might have been for naught almost?
I look at the stats from our state website about how we're going to be totally overwhelmed. At the worst time, we were using about 50% of the ventilators we had available in New Jersey. And that was even, we took a lot of people from New York, and a lot of people ran out of New York and came to New Jersey. So we were taking care of a lot more than just our people from our state. I think that we can handle this, and we've been handling it. We're learning more about the disease every day. And hopefully, as we go forward, the people who get infected, as we quote, flatten the curve, won't have such a severe disease as people where we didn't understand the disease quite as well early on.
Dr. Roethle, here's something that someone threw out the other day that I'd love your take on. When we've been doing this self-quarantining and not been out exposing ourselves, does our lack of interaction with bacteria undermine our immune system? Do you know what I'm saying? That because we're not out there, our body's not fighting things off, and that when we re-enter society, we actually may be more susceptible to getting the virus. Does that make sense?
I understand your point. I don't think that there is a lot to that. If you raise yourself in a bubble, you're not going to develop an immune system over time. But I think a short period of time like this isn't going to affect our immune system. Um, Most of us are carrying around antibodies to a vast majority of infectious diseases out there, but you'll get infected by a bacteria whether you're in the house, outside of the house, exposed or not exposed. The biggest thing is just the new viruses, the run of the mill colds that come through. You're not developing that new immunity, but I don't think that's something that we have to be concerned about.
Interesting.
Dr. Livornese, a lot of people are talking about the use of masks. Obviously, we're seeing most people wear them now, of course, in New York City as well. But some saying, actually, they may not really do anything. They only protect you. And now I've heard that maybe even gloves aren't really that useful.
Well, with masks, it's simple. My mask protects you. Your mask protects me. Gloves are essentially useless unless you know how to take them off and you wash your hands after you take your gloves off. I mean, when I come out of a COVID positive room, I end up washing my hands about 4 or 5 times by the time I get all my PPE off. Have you ever seen someone walk out of the grocery store? What do? They take the gloves off, throw them in the garbage, and then they wipe their nose. It's just like not wearing the gloves.
Yeah, so the key is to actually make sure you take them off properly and then wash your hands if you're wearing gloves.
Right, but you shouldn't even wear gloves because the only thing some people say is that wearing gloves may cause you to touch your face less because you feel that tactile change. But other than that, gloves may just give you more sense of security, a false sense of security.
Dr. Roethle, one of the things that got put on hold during this whole self-quarantining period was elective surgeries. You yourself, I know when we talked last time, had gone out to New York because you weren't doing as many. Have we gotten to the point where some of those elective surgeries aren't as elective anymore and we're going to have a bit of a backlog? And now we've got people that have been waiting, upwards of 30 days to have something that might have been routine or elective, but isn't routine or elective anymore now?
There's definitely a backlog, and the country's slowly getting back to adding those cases back onto the schedule. Most of those cases will still be elective, haven't become urgent or emergent. We were able to do most of those cases anyway. So if it is something that becomes, truly urgent and needs to be done, we can definitely handle that. We never really turned that off, but it was a kind of a gray line. What is exactly elective and what is exactly urgent. We're getting to the point where we're putting those surgeries back on. We're trying not to keep patients in the hospital for a very long period of time, especially in areas that are where the disease is more prevalent. But we're slowly getting back to that. And people that have cancer need to have cancer surgeries. Those things definitely need to be taken care of.
That's interesting. I'm glad to hear you say that. Well, gentlemen, thank you both for being with us. And I want to associate my comments with Dr. Livornese. Scott, thank you for going out there and serving the people of New York and our country. It great on you, and thank you for stepping up.
Thank you.
All right, gentlemen. We'll see you soon.
All right, well, up next, a change at the top of NBC News. But will that mean a change in the network's culture and their approach to covering the news? Plus, you will not believe who the New York Times is calling on to lead the investigation into the sexual charges against Joe Biden. Stay with us.